And I have one more back here.
I like the team spirit and running fast, and then like being just coming home and rest.
Great. Okay. Thank you very much. Well, I'm done. Thank you. Okay, so there's the answer from the real experts. I'm just briefly, before I move on with my own tips, going to tell you what tips I have from other experts from the field. As was mentioned, I've run a research study in East Palo Alto looking at team sports as an intervention for overweight kids. So over the past 4 years, I've worked with over probably 40 children playing sports, many of whom were not previously physically active. And children were randomized either to be in a sports program or to get health education once a week. And many of these children and their families told us that if they were randomly assigned to the sports program, they wouldn't participate. The children wouldn't participate. The children told us that they don't like sports. They wanted to be in the education program. We explained that they were going to be randomly assigned, and whichever arm they were in would be the arm that they would participate in. And so we did have quite a number of children enroll in the study who were not interested in playing sports. And we then asked them why they had not previously participated in sports. Many of them had had negative experience in the past or thought they weren't very good or they couldn't run and keep up with the other kids. So we aim to provide a really positive experience for them in sports with other kids that had similar experiences to them and weren't the top athletes. And then we followed them over time, both following their weight as well as asking them questions about their experiences with sports. And we've also followed them subsequently after the study has ended. Many of them who had previously said they did not like sports at all have gone on to join sports teams at their schools. And one in particular I had seen recently who had every day of the program, which went on for a year for that particular child, she would tell us how much she did not like being out there with us. And then 2 years later, I saw her running around the track with the competitive soccer team at her school. And I asked her, or I expressed to her with surprise that I was surprised seeing her there because I thought she really didn't like running or soccer. And she said, oh, that was when I was younger. So I think that was a really great lesson for me working with these children, that saying that you don't like physical activity or sports might equate to having had negative experiences before. So we really need to provide positive experience in sports. And then one of the other questions we asked the kids were, and these were again kids that did not think they liked physical activity, and we asked them, what did you like about being a part of sport, which was the name of the program? And very similar answers to the experts that we have in this room, but top ones were having fun, being with friends, the coaches, and being a part of a team. So now I'll move on to my other tips. So in terms of us trying to help our kids be more active, my number one suggestion is playing. So be active with your children. Go on family hikes, do sports. Kids like spending time, and I know we have some with adolescents here, so I know that can change as they grow in terms of wanting to spend time with their parents, but particularly at the younger age, the kids really value that time with the parents, and you can speak for as they get older as well. I think they do as well. So if that time can be spent in physical activities, going on hikes, playing sports. Also at the younger age, before there's the proficiency in sports and the competitive leagues, if you can get out there, even if you yourself don't like sports or have had negative experiences, it's really fun just to get out there with the ball with your child who you at least have equal experience with the sport. And it will both have them have a positive experience with sports since they enjoy spending time with their parent, and in addition will help them to start develop the skills so that they'll be familiar with sports as they go on to become school age and other kids are playing. And then we can also incorporate physical activity into our daily routine. So walking or biking from school, I mentioned a brisk walk as a form of moderate intensity physical activity, and I was thinking to myself as I was putting park walking distance from school, when I say park walking distance from school, don't look for the closest parking spot to school, but rather if you do need to drive to school, if you can't walk or bike to where your school is, park a little further away, which will force you and your child to get that walk in the morning. Usually what happens to me if I'm not biking or walking my child to school, it's because I'm running late. And if I'm running late, that means I'm going to have to park very far from the school. And if I have to park far from the school and I'm running late, that means we're really late. So we're doing a brisk walk every morning if I drive, and that works. And my brisk walk for my kids is almost a sprint for them. And then also just to mention, October 8th of this year is National Walk and Bike to School Day. And I don't know if there'll be publicity within the communities, but on that particular day, if you remember October 8th, walk or bike to school. And it's actually October is an international month recognized as a walk to school month internationally for many different reasons of the benefits of walking to school and raising recognition of safe neighborhoods. There's also something called walking school buses, which some communities have developed, where instead of a school bus picking kids up at different stops, an adult member of the community, or in some cases, a teacher or principal from the school, will walk to different stops. And when it's been a principal in communities, it actually gives that principal a chance to get to know the kids from the community from walking from different stops. My next point is to be an advocate for your children in many ways, but around physical activity, find out about the after-school programs in your community that include physical activity. You can ask your school, the community center, local YMCA, Boys and Girls Club, and we have great opportunities in our area, so we're very fortunate. Signing a child up with a friend can be a great way to get them engaged if they think that they don't like a particular activity. If they do it with a friend, they'll be more likely to have a positive experience. Again, as I mentioned before, the negative experiences might not be about the activity, but rather the overall experience. And if a child's going into an activity with all unfamiliar peers, then they might just not enjoy being there. Rather, if they go in with a friend, there'll be a higher chance that they'll have that positive experience. And try different activities, so team sports, dance, swimming, jump rope. And then finally, limiting sedentary time. So children should not be using media more than 1 or 2 hours per day, and that includes television, video games, computers, and we do not recommend having a television in the bedroom. There's been studies to show that a television in the bedroom is associated with lower academic scores as well as overweight. So finally, I'm concluding with this letter, which was not written to me, but it was written to the doctor of a pediatrician who referred the child to our sports program. And this was a child who said that they did not like physical activity and did not want to be in the soccer program, and also went on to participate on the soccer team at her school. And she wrote, "You're the best doctor ever. I hope when I grow up I could be a doctor like you. I'm glad you put me in this soccer program." So hopefully that's the goal, that all of our kids will enjoy physical activity.
I hope everybody's jotting down your questions. Just one more presentation, and then we'll have some fruitful discussion on these great topics. Thank you, Dr. Weintraub. Lastly, we're going to hear from Dr. Rafael Pelayo. And Dr. Pelayo is Director of Pediatric Sleep Service at Packard Children's Hospital and an Associate Professor at the Stanford University School of Medicine. Dr. Pelayo, since 1993, has specialized in sleep medicine at the Stanford Sleep Disorder Clinic. And this clinic, located just here in Palo Alto, provides comprehensive evaluation and treatment all the way from newborns through adolescents with disorders of sleeplessness and sleepiness. I think parents also probably could benefit from this. Dr. Pelayo received his undergraduate degree from the University of Puerto Rico and his medical degree from Albert Einstein College of Medicine in the Bronx. He also completed his residency there. Following his residency, Dr. Pelayo completed a fellowship at Stanford. Over the years, Dr. Pelayo has lectured throughout the country and internationally on sleep disorders, and we also feature him regularly in the media on this topic, as there is many of us who would like to know how to best address sleep disorders within our own families. So, Dr. Pelayo, we welcome you to the podium.